Kendra, thank you for doing this.
Of
I
course.
mean, yeah, I'm sorry we didn't get to have the class, but this is a good option or alternative.
Yes, for sure. For
Yeah, yeah. Well, do you want to start off telling us what it is you do? I know that you're in the bodywork profession already, right?
Yes, yes. I'm a massage therapist. I
Hmm.
graduated in 2009, so I've been a massage therapist for about 16 years now, which I was doing the math and I was like, this just blows my mind that I've been in the industry that long, that long.
Yeah.
So yeah, so I work out of two offices. One is a counseling and wellness center, and then another one is a holistic health practitioner's office. So I it's been interesting, and I've been
Yeah.
in those two locations within the last 4 to 4 years. I worked out of a massage a massage center. There was just massage therapy there for about 9 years prior to that.
What type of massage did you practice before you started with creative healing?
So just it was always classified as a customized massage. So we could do deep tissue, we could do Swedish, use sports, whatever we needed to do within that session. I was known for doing deeper work, deep tissue. And you can't tell, but I am not super tall. And so it was like people would come and be like, "What? You can do deeper work?" I'm like, I can. And it ended up being really hard on my body. And so when I found this work, it was amazing. I was like, okay, I can still get a lot of those same um, results, but in a much gentler way.
Yeah.
Great. So are you doing it? You're working in two different locations, right?
Yes.
So you're using the creative healing in both locations, or is it just one or the other?
I do because I see such a diverse clientele and what their goals are at the holistic health office. She does nutritional response testing with energy muscle testing, and so we're able to work a lot more with the organs in that regard because we're able to kind of figure out what's going on to help heal the body, working with the autonomic nervous system and that type of thing. So that when I'm working there, I use a lot more of the Stephenson, the creative healing method there. At the counseling center, depending upon what they're open to, honestly, there are some clients that I have seen for years that I'm like, are you okay? If we would try this, just to look at it from a different perspective. And most of the time they're
Mhm.
okay, but some they are set in what they would like. Um,
Yeah.
and so sometimes, like if it's a newer client, um, they're more a little bit more willing to try something different because they've never really experienced anything with massage. So it just kind of depends upon what their goals are. But whether they realize it or not at the wellness at the counseling center, I do use the method there. It's just they just may not be aware of it. Be aware.
Yeah. That's a beautiful example of the mind-body connection,
Mhm.
being able to incorporate it as well.
Yes,
Mhm.
yes. I was actually talking with the clinician about it, and she was like, she's doing I'm going to probably say it incorrectly, but like a neuroscience certificate type of thing, and was talking about, when we're talking about healing the body, just in like in with therapy specifically, you work from, how was she saying it? The working the brain from the top down, but whenever you incorporate um, massage therapy or something along those lines, like it works from the bottom up, and so you have a more rounded healing experience whenever you incorporate both. So that was something that was really cool.
Wow.
Kind of throw that in there.
Yeah.
That's great.
'Cause, I mean,
So
most of
you've
us
also,
are working with traumas, but also emotional is the same way. It's the
Yeah.
trauma.
Yes.
So,
Yes. Yes. And I was going over some questions that Summer had sent me earlier, and um, I was writing like, why do I like this work and whatnot? And I believe that the body is a lot more complex than what we really understand, and so using this modality, I'm able to get a bigger picture. And we talk about that whenever we're doing the learning the general treatment. Learning that and looking at the back, it gives us such a broader picture because we're looking at the spine, we're looking at how the body is sitting, and all of that. And I say, the body tells on itself, whether it really knows it or not, if we're looking for that. And so looking at, physical trauma from car accidents and how the body's holding that to emotional issues, that type of thing. It all plays a part. And I just love how using creative healing, I'm able to bring all of that together.
You've also been hosting classes, right?
Yes. I've been helping with Summer with that.
Yeah. So what got you into wanting to bring in more people? Is this people that you work with or?
So some are massage therapists that are local. I have had a couple of clients or some friends that want to learn this. There's one of my friends who wants to go into massage therapy, and I was like, you need to learn this first.
Great.
I wish I would have learned this beforehand.
Aww.
And and I went to a massage therapy school where we learned cranial sacral. We learned a lot of different modalities, and this just brings it all together in learning to read the body. And I'm like, this would be so good for you to learn first, because it's not going to be taught like this in massage therapy school, and it gives you a really good understanding of the whole body, more so, if that makes sense at all. I
How
know
it ties together. I agree.
Yeah.
It does. It ties it all together because I had the opposite experience. I learned the Stephenson Method first, and then I went back to massage school, and to see the two, how they're interrelated, how the one explains the other.
Yes.
And it makes a lot of sense.
Yeah.
It does.
Can you tell us some of your experiences since you've learned creative healing?
Sure. The one that sticks out to me the most was after I had just learned, it would have had to been the third class. So this was, I don't know how long ago that was.
Was that in 16?
No, it might have been. No, it was after. My daughter was, I measure it by time by my daughter, because when I learned the first two, she was 6 months old. So
she got to take part of the class with us. She sat in with us on the class.
That's great.
But I think she was about 2 to 3. So about 3 years ago, I had taken the third class, and learning the high short breathing, or high low. I forget the technical term of that, but it's working with it's working with the diaphragm.
You're right.
And it was with a client that I had never worked with before, and they had come in. They were in a motocross accident like 5 years prior to that, and just talking about the trauma that they had with their body, and what they were dealing with. And I was just like, okay, I feel like I'm supposed to do this. I'm like, I've just learned this, so just bear with me and whatnot. And this client was saying, that they had tried to do retraining with stretching, with breathing, because they couldn't ever take a full breath. And after doing that treatment, they sat there in the chair and were just like, I can breathe for the first time. And
wow.
And it was like it shook them a bit, because they were like, I can't believe that. But if you look at it from the handlebar went right into their abdomen, and so of course that's going to affect the diaphragm. That's going to affect how everything else is in the cavities. It's going to affect struggling with anxiety because of the nerve that go through all of with the diaphragm. And they were just like, oh my goodness, they were amazed after that. So that's the one that that I just love that experience from it.
Great.
Another one, it was right after I took the third class. It was a client that I've been seeing for a long time, doing like the traditional massage on a weekly basis. And I still see them pretty regularly. But I approached it and I was like, okay, I just learned did this class. Would you be okay with me trying, working at it from a different perspective? And they were like, oh yeah, like whatever you want. Like, I trust you, you do. After that first session, like I felt like their whole demeanor changed. They were able to bend over to tie their shoes, like it was really, really cool to see how just one session affected the whole mind body aspect of it. Another client that I made a list here. Another client
I love it.
that
I also have to say, I love your enthusiasm. It's contagious. It's awesome.
No doubt.
I love
Yeah.
this. And I talked to my husband about it, and he's like, okay, like I nerd out about it.
Yeah.
That's great.
But I had this client that she had fallen down some stairs and just went on her tailbone, just went down. And they were like, she was like, I just have this back pain and it's bothering my knee, all of this. I'm like, let me try a hip lift. Just let me try. And they got up, and I saw them the next month. They were like, it went, I don't know what you did, but it went away. Like it was gone. And I'm like, this is just like the small piece that if like, even just doing a hip lift on anyone is going to make so many things better. But not everyone is open to that. You know what I mean? And so I kind of have to work with.
But please sit down and let me bend your butt.
So that was just really cool to see. Those are some of the more recent ones when I had just taken the first and second class because Summer had taught them both at the same time. I was working at my the previous place at the massage center, and I was working on an older gentleman, and he came in, and I don't remember if you telling me or if you remember me telling you about this, Summer, because I was like, they were face
I
down.
love all your stories, so go ahead.
Yeah.
And just doing vacuuming over their lungs, and I felt the crackle of like what
I do
would have felt like, and I was like,
Wow.
was that pneumonia? Like what would? And Summer was like, yes. And the next time the client came in, he said, I had pneumonia. Like I was diagnosed with pneumonia after that. So it was just really cool to see. I'm like, oh my goodness, that's so cool. Being able to find these things and to address them and be able to be like, not saying this is what it is, but this is what your body is showing me. This is what
your body doesn't lie.
It doesn't lie. It doesn't lie at all. So that's just some of those stories that it makes my heart so happy when
I have to tell a story on you.
Yeah.
Because so I remember when the first was it in class or yeah, I think so. It wasn't I didn't see you before I saw you in class. Was that your first experience?
No, I had come with Aunt Bonnie.
Okay, so you had come with me to the office.
Yes.
So my first experience working on you was such a revelation too.
Mm-hmm.
Because when I started working on you, you were like, how do you know that?
Yeah.
What's happening?
Yes. Yes. I had first learned about the Stephenson Method from my husband's aunt when she was a very eccentric person and she was a client of Summer's, and she has since passed, but she would be so happy to see just the work that I'm doing with this. She was a huge believer with it. But she was like, you need to come see my massage therapist because it's more than physical therapy. It's more than massage. It's something so much more. And I'm like, I've never heard of this. Like, are you sure this is, what you're talking about with this? And so I was able to go see Summer, and I don't think you knew that I was a massage therapist at the time. We surprised her with that.
Which I love. That's fun.
Yeah.
But
Yeah.
she was looking at me, she was like, well, oh, that's what I see. And I'm like, what do you see? Like, how can you see this? And so that was really intriguing to me. And I just love how it just brings it all together. Just honestly, just learning to read the body and understand the body in a bigger way.
So the examples that you were giving, was that like your first opportunity to use those treatments, or had you used them before and gotten results? Or was that the very first time?
That was the one with the pneumonia. I had worked with that client before. So
Okay.
but I had just learned the modality. So I was still very new at it. And I was like, I think I know what I'm doing, like, I think this is what this is, or this is what I was feeling. The other ones, the one with the high short breathing, that was the first time I had worked on them.
Okay.
And then the other two, I had been working with them for some time, and I was like, okay, are you okay if we look at this from this perspective?
Right.
some I've tried that with, and they're like, they're not crazy about it, which is fine.
Hmm.
Like they have their own preferences of what type of massage they feel like their body responds to. And so I respect, what, because it's their time too, as they're on the table.
Right.
But yeah, so those were the first couple of times.
So I think
But
what
it
Charles
was
was
your,
asking
Oh,
is,
sorry.
I think what Charles was asking is, so you had been doing massage, you learned this new modality. So the first time you did it, was it like an when you saw the need for it instantly?
Mhm.
So like that was the first pneumonia treatment you had ever got given.
Right.
Did, was it easy to
outside of
transition?
class.
Did you know exactly what you needed to do when you felt
Um,
it?
yes, it took me a little bit to feel confident in it.
Yeah.
Um, the first couple of clients, I was like, I'm having my notes right here, making. But I
Okay.
I don't want to like. I feel like I was pretty intuitive with it, being able to see some of those things. I'm like, oh, okay, like this is getting the bigger picture. It was a really big mind shift when I was sitting in the class, because I was like, this is not what I had my understanding. Like, you don't need to know like straight up all of the and muscles and the anatomy of things because you have landmarks. You don't need to like, and that's when I would talk to some of my friends about, it's like, you need to take this, like you need to you can learn this. They're like, I don't know anything. I'm like, you don't have to. Like, that's the thing that I love about this too.
Yeah.
But it took me a little bit of time to feel confident in it without my notes. um
Yeah.
Okay, I
Yeah. I
use
think
my
it,
book a lot.
mhm.
yeah. Yeah, I think as a massage therapist, like if you're doing just the lifts on the hips, that's not a big deal, right? But if you're doing a lung treatment or a high and short breathing treatment, that's quite a difference from doing a typical massage. So if that
Yeah.
was your first time and you got those results, that's very impressive. I mean, I think that's great, you know. Uh,
Thank you.
So you've had all three classes or
Yes, I've had all three.
yes?
Done the first class how many times? Like four, I want to say. It's a thing with assisting and hosting. And I've done
Right.
the third class twice and the second class once. We were supposed to do the second
Right.
this week, but
So
we'll
if we had had the class this weekend, then which was canceled due to snow, just to update everyone,
yes,
um, then you would have had the whole entire thing twice.
yes, yes.
Are you wanting to teach or what's next for you?
That's a good question. I would love to be able to do that at some
Hmm.
point in time, if as my life allows me to. Um, because I think it's something that it's it can change lives. It makes such a huge difference in people's bodies, and I think it's something that I really hope more people can learn. And which one reason why I love doing the classes is because I'm like, I see things click, as they're working, like, oh, that makes sense. But I would love to be able to teach that at some point in time if I'm able to.
Yeah. You've taken the classes a couple times. Do you see benefits every time you take it, or is it just kind of a refresher, or how do you feel about doing the class again?
I love taking them again because I learn something new every time. And since like it's been some time since I've taken the second and third classes, when I took the third class again, I was able to hone in some of the skills that I had already been, since I've been practicing those treatments. I was able to hone in on them more, or I'm like, oh, so that's what it was. Or just being reminded of where the exact points would be. Something I struggle with to this day, and I'm getting it, is just finding the inward goiter, the thyroid point on the back.
Yeah.
But I intent is a huge part, as I am finding out. And so my intent is there, so if it's not the exact point,
Mhm.
my intent is there, and that's going to make a huge difference as well. So but yeah, it definitely hones in the skills that I'm practicing and learning.
I found too,
Good.
because you have the experience now to put it into context. So the first time you take it through, it's a lot of information to absorb, and you really haven't
Mhm.
used it much. But then the second time through, you've used it, you have a little bit of context to place the information in, and it seems like you really are able to, personally speaking, I feel like I'm more able to understand how it ties together by going through it a second time. And then teaching it does even more for that because I've found that even while teaching, I'll have aha moments like, oh, this is why this works.
Mm-hmm.
And it'll hit me as I'm teaching.
Yeah.
So it's that learning is a continual process on every person and in
Yes.
every class.
And it's helpful in me being able to explain that to my clients as to what I'm doing, what's going on with their body. Like, okay, this is like even just working with the heart treatment, like, okay, this is what Mr. Stevenson felt was there, and this is what science is proving, and this is what I'm doing. You're gonna probably feel this effect, working with the gurgling and how this is going to affect everything. And so taking them again and again is helpful in that part of educating the client as well.
Mhm.
I think that's true.
Now you were saying that the one location that you work at, they take more of a holistic approach, right? So is it like a person that you're working on would also see another therapist within that same location that does a different modality or a
Um,
different?
so I'm the only therapist in both locations. Um,
Okay.
so in both places, I will say that are more of a holistic mindset. The counseling place, we have yoga there, we have emotion code, we have some other different therapies there as well.
Okay.
So we are a collaborative organization,
Mhm.
and in both locations. So with the holistic health practitioner, um, she's trying to figure out, the root of the things, working with the autonomic nervous system. And so she'll see a client beforehand, sometimes after, and it's really cool to see, like, if I'm working on the client first, and then they see they
Oh,
see
it's so fun.
and
Yeah.
I want that.
like, this is
Yeah.
kidneys were warm, like, check this, and 95% of the time, maybe a little bit higher, what I found is exactly
Oh,
what
that's
showed up.
so cool.
And even if it's
Wow.
not, doesn't show up right away, like, I had a client that was having some spleen stuff going on, and I was like, has your spleen showed up in testing yet? Has it showed up? And a couple weeks later, she was like, it showed up. And I'm like, see, I knew it. It's those types of things that are just really cool. And
Awesome.
Mhm.
yeah, so, and then working with at the counseling center, being able to look at it from um, a whole perspective of trauma and how that affects the different organs and how that affects the different parts of the body, what is being held here. Working with anxiety a lot of the time, and working with the whole body, working with the diaphragm, working with the lungs, being able to train and taking deep breaths. All of those parts play a huge. It helps the person as a whole as they're going through these different types of therapies.
Wow. That's great.
Yes.
So, I mean, there's not like a specific therapy that you would recommend that complements the creative healing work, but it's more of a like all inclusive. All these things kind of come together to work together, right?
Looking at the body, I mean, I believe, we are body, soul, and spirit, in different
Mhm.
in different ways. And if you address one part, you're going to have to address the other because it all plays a part into our bodies. So
Yeah,
so being able to approach things from all of those three different areas is really cool to work in places that do that.
that's great. Yeah. So, is there a reason that you work both places, or instead of
Um,
just focusing on the one?
I love both concepts.
Hmm.
It's like
Mm.
I've thought, like, do I just want to work at one place? Do I want to work at just, or whatever? And I'm like, I can't give up either one of them. I love the business model for both of them. I love what I do. I love the clientele that I see on in both places. Um, so I just love the diverse clientele, and that I'm able to do and use the different tools that I have learned, and that I am able to do. So
Yeah, that's
Awesome.
amazing.
Yes. Now, I know when we're in class, one of the things that lots of my other students want to know from you is how you incorporate it. And you touched on that a little bit. Um, but would you say, what percentage would you say of your massage is the Stephenson method versus traditional massage?
That's a really hard question, because one practice is almost 100% the Stephenson method.
Okay.
The other one, maybe 50%. It just kind of depends upon again what the goals are and what they're willing to do. Whether they, though, whenever I'm working the arms or I'm working the neck, doing the general treatment, working with vacuuming, working with the nerve channels and all of those types of things. So whether they realize it or not, like, they are getting some of the Stephenson method. It's
Right.
usually in a supine position. they're just laying down versus being seated.
So you're incorporating it, which is what I was getting to. Is
Mhm.
it difficult to incorporate it even without them knowing, just using what you know to help them without having to explain every step of the way?
Not really. Whenever it just started to come more naturally, and it's honestly because it's such gentle work. I have found that our bodies, like, if we are stressed, if we are in that fight or flight, like, if we as therapists use more pressure, sometimes their bodies actually respond well to that. I do have a couple of clients that is what their bodies need. um, but a lot of the time our bodies, we need that gentle work. Our bodies respond better to that. They're like, oh, okay, I don't have to be in this high anxiety state. I can just take a minute and just breathe. And
Yeah,
that's what this modality allows, the slower movements, the more gentle work. um, yeah, and so I've started to transition my work from more of that deep tissue work to more of a gentle approach, and the Stephenson method allows me to do that really easily.
that's great.
More of that
Is there
rest and
other?
relaxation.
Mm-hmm.
Sorry,
Yeah.
Charles.
No, you're good. I was going to ask though, like, I know you're putting in a lot of time learning the Stevenson method. Are there other modalities that you're still learning or other educations that you're pursuing?
I have not done a whole lot of that, as I'm raising my family. It's harder for me
Mm,
to um, get away, and
yeah.
this is something that's really close to my heart, and that I just really enjoy learning. So this is something, and that's actually something I'm like, okay, once I've gone through these classes X amount of times, like, okay, what am I going to do next? And some of the things that are on my list are like lymphatic. Honestly, some trauma therapy would be really would be good to learn for both places. As our bodies,
Yeah.
we experience trauma all the time, whether we realize that it's a big T trauma or a little T trauma, type of thing. Um,
Mm,
but those are some of the things I think lymphatic would benefit and work really well with the Stephenson method, just because of what we are working with. Um,
mm.
Cupping is another one that I've thought about going into and just learning about, but right now this is my focus.
Good. Good. I know that really any body work will have aspect of like emotional release and stuff. You had mentioned one of the clients that you worked on, their whole personality seemed to have changed after you worked on them with the Stevenson method.
Mhm.
Have you noticed any more of that or?
I don't see it as it wasn't. If it does happen, I don't see it as big of a difference as I
Mm,
did with her. Like, it was like my goodness. It was
Solar plexus will do that.
yes,
yeah.
it was very, very evident. Um, I don't see that. Well, you know what? Actually, no, I take that back. There are a couple of clients that come in very, like, whew, okay, we got to settle you down here for a minute. And they do come out of the room a lot more like, okay, like, yeah, you come down a couple notches. So um, it's those types of things, but it's maybe on most people it's a lot more subtle than some of those more
I
higher.
always say that I'm not trying to cause an emotional release, but if it's there, I'm going to support what happened.
Yes.
Good.
So it's not necessarily the intent to
Right.
do
Mhm.
that, but it is helpful.
Yes, for
Are
sure.
there specific treatments that you seem to be doing more of than others? I mean, whenever
Um,
you see clients?
right now, really doing any type of lung pleurisy, whether it's that or
Mm,
pneumonia or asthma, sinus is
wow.
big right now.
Hmm.
The the heart treatment is one that I've been seeing a lot more.
Wow.
Just trying to as yeah, and when we learn about it, Summer makes the comment, like that's where we hold, our heart is, that's where we hold the things that are most precious to us, and it can be very emotional, and as I don't know if you come across this, Summer or Charles, in your practices, but as a therapist, people just kind of like dump a lot of the stuff too, and so as we're working with the heart and working with the things that
Happens.
come up, it makes sense to me, we're going to need to address the heart in that manner. But doing a lot of digestive tune-up stuff too, just working the abdomen, which is something that actually really intimidated me for a really long time. In massage school and whatnot. And I feel like I have a really good, after doing the third class again, I feel like I have a better visual of what is going on in the abdomen and the importance of doing those different organs, and working with.
Nice. Yeah. So what class has been the most beneficial for you?
Oh goodness. Um, I would probably say the third one with the organ work. Um,
Mm.
has probably been the one because it's something that, especially at the holistic health office, it's something that we focus on there a lot with what she's addressing and how we do that collaboratively. Um, but yeah, I think honestly that's the one that I just enjoyed the most because it's
Yeah.
so cool. It's how everything builds upon everything else.
Mm.
Yeah, so I think that's probably it, also because it's my favorite one.
But yeah, me too.
Yeah.
Is there anything else, Kendra, you feel like you'd like to tell people that might be thinking about either lay persons that don't know anything about massage or massage therapists that you would like to tell them why they should do this work?
That's a good question. Um, if you want to learn how to read the body and look at the body in a much more wider picture, like with a much bigger picture in mind, this is the perfect work for it because you're able to look at it from multiple layers. You're not just looking at the muscles and tension, which is we do, but we look at it from another layer. We go deeper. And I feel like there with different modalities, it gets a lot more complicated of like, okay, well, this muscle's tightened, this one's shortened, which is part of it, but it just makes it simple. It's like, okay, well, your shoulder's higher here. So let's look at doing the shoulder treatment and looking at the contractions that are around the shoulder blade. Oh, like I'm having numbness. Okay. In the arms, well, let's do the shoulder, again, and work with the corporate process, and all of those types of things. And just being able to look at that from a bigger picture. I think that's what I just keep coming back to is it helps you learn to read the body and to look at it from that whole wide range of things, and just how things from being when you're being born, or being in utero, and how those things all play a part into where our physical health is now, and it just gives a complete picture. It's not just, and I think this is a good example. So, in the medical profession, we have doctors that specialize in GI. We have doctors that specialize in bones and muscles and all of those different things, neuro. And so many times I hear, I'm like, I just want someone that just gives an overall general thing, and that's where like,
The whole body.
but looking at the whole body, and that's what this does.
Yeah, that's well said. I like the way you put that because I mean, I think everyone runs into that issue, right? I mean, it's just seems like everything is so segmented now that it'd be nice to go back to the holistic approach. So I think that's well said. Yeah.
Very nice. And
All right.
I also want to put in my 2 cents. I want to say, I want to give a shout out to your Aunt Bonnie, who's passed away, because she sponsored my first class and for her support of you as well in learning it. So I just want to add a thank you in there for her
So
as
that was
well.
Bonnie that was with you that came to the class?
No,
Um,
Oh,
Go
okay.
ahead.
Okay.
she was the one that she was a client of Summers, if I can state that,
Mm, mhm.
and she was the one that took me to get a massage from Summer, and that's how I
Okay.
her. And she just had such a heart for this. She was like, "This is everyone needs to know this." She was very adamant about that. Just looking
Wow.
at a holistic mindset, and she's like, "This is where everyone needs to learn this." And so she was very supportive of all of that.
Yeah.
That's beautiful. Yeah,
And she
love
was
that.
the reason I was able to do the
Mhm.
first class, and also she supported Kendra as well and her wanting and encouraging her to learn it. So just a little
Yeah.
shout out there at the end for Bonnie, and
Yeah,
um
very great.
not to undermine all of the good that Kendra is doing now because of that.
She was the
So
catalyst,
many
and that
good things.
Yeah.
and that's the important part.
Well, Kendra, I just want to say it's good to finally meet you. And I really, Summer talked about your enthusiasm. It definitely shows through. And I've certainly enjoyed hearing all your stories. And I love how much you love the work, and
Mhm.
your approach to it is just very fascinating. I've enjoyed this.
Thank you. Thank you. This was good.
Yeah.
Good.
Yeah.
I can't wait to
All
share it with
right.
everybody else too. So
Yeah.
thank you. Thank you for letting us interview you.
Of course, of course. I'm glad
Hey.
this worked.
Yeah. I hope we get to do it again.
Yes, for sure.